Welcome to Sex on the Floor podcast. This podcast was created to help educate the public about problems with sex and intimacy and how this is tied to both physical and mental aspects. Hosted by myself, Dr. Molly Hart, a passionate pelvic floor physical therapist and owner of Pelvic Balance Physical Therapy, and by Dr. Katie Schubert, a phenomenal sex therapist and owner of Cypress Wellness Center. We are here to have a good time. We're here to keep it real with you all and to educate along the way. I'm so excited for you to join us. We strive to help many relationships prosper in fun, safe, and healthy intimacy. While listening to the show, please remember that this information is not meant to diagnose or treat any medical conditions. Please speak with your medical provider for all things related to your health care.
Welcome to Sex on the Floor. My name is Dr. Katie Schubert, and this is Dr. Molly Hart. And today we're going to be talking about how to discuss bodies with young children. We're going to break up today's episode and the next episode because we feel like talking about bodies with children and then talking about sexuality with, teenagers or tweens should be different conversations, and we should be focusing on both of those things separately. So today we're going to be talking about how to discuss bodies with children who may not be ready to talk about sexuality and sexual relationships.
Yeah, absolutely. So really focusing more on an anatomical, physiological aspect of the body. Dr. Katie and I were talking before we recorded this, and we talked about separating this from sexuality because we're very aware that there are a lot of factors that play into how parents want to raise their kids when it comes to sexuality and their cultural and religious beliefs. And I'm going to be very sensitive to that because I think that's important. But anatomy and physiology of the body is anatomy and physiology of the body. And I want to make sure that parents don't bleed in their cultural and religious restrictions and views onto that, because when you do that, you really can affect how your child views their own human body. And that is a no-no. I mean, really, like, I can't tell you how much sexual dysfunction I see in women who are married. They wait to have sex because of religious beliefs, let's say. Often I see this, and then they finally are with their husband and they still have so much pain and so much dysfunction. They don't know anything about their body because it was such a shameful area growing up. And so it's just so important you empower your young boys and girls to understand their little bodies. So that's what we're going to focus on today.
Yes. So I guess maybe we should split this up and maybe talk about little girls first and how to discuss anatomy with little girls. And then we can discuss how to maybe talk about anatomy with little boys as well, since it's a little bit of a...
Yeah. And again, this is also, this is us using our professional background and also just, our beliefs and our opinions. So you don't have to 100% agree, but we're just going to share how we view things. And I do think we have way more understanding and education than most people. So take it or leave it. But for me personally, I've got a daughter. She's 3.5 right now. I started teaching her about the names of her genital region when I started teaching her about all the other body parts, which we start really at quite a young age. I mean, you start doing that. I do it now with my son who's 1, but he doesn't really fully get it. So around 2, I would say it became more of a conversation piece, and we started potty training around that time too. And so just like you say, here's your nose and here's your eyes and here's your ears, I do the same thing with her genital region. So I would say, here's your vulva. And when I do that, me personally, I just kind of would put my hand on that area, like that whole area, or I'd have her put her hand, I'm like, this whole area is your vulva. And then, they're little kids. So sometimes she's running around naked and she'll just like flop over and like spread her legs and everything's out. And she thinks it's the funniest thing. And so honestly, I take that time to then not shame her. I do not say, oh my God, close your legs. No, I'm not going to do that, because when she's running around and flips her arms open and goes like this, we're not like, oh my God, cover your armpits up. Like, that's weird, right? So I do tell her, you can only be naked at home. I'm like, you can't be naked anywhere else, but being naked at home is perfectly okay. And then I taught her the word vulva because that's more anatomically correct. But in my house growing up, my mom called the vulva the chachi. And it's totally random. I don't know why. And my nickname growing up was Chachi Bell. And I thought everyone knew what chachi meant. And so I used to be so embarrassed. And so I interchangeably use the word chachi and vulva. And I like that. So sometimes she calls it whatever she wants. I think it's okay to have cute little names for the genital region as long as they also know the anatomical name. And that doesn't have to be the only name you use. Like, think about the belly button. We call the belly button the Bebo, or we call the armpits, like, I'm gonna get your tickle pits. So like, we make cute little names for kids. You can totally do that with that region, but they also need to know, like, no, this is an armpit and this is the belly button. And then from there, more recently, my daughter's 3.5 now. I have showed her now, like, hey, this is your butt. This is your vagina. This is your clitoris. This is your urethra. Like, I actually point with her finger to those areas when we're doing a bath. And some people might think that's weird, but I'm like, no, I want my daughter to understand and know this. She'll look at her brother and she'll point to his penis and she'll go, penis. I go, yep, that's his penis and that's his genitals. And you don't touch it. Those are his areas to touch, but you can touch your own. And so right now, that's a big thing I'm teaching her, is like, you're allowed to touch yourself, and only mommy and daddy are allowed to touch there, and your teachers, when they're wiping, like, which people are allowed to touch there and why. And she'll say, she's so cute, she's like, my vulva, no one touch. I'm like, that is your vulva, you're right. Mommy and daddy can touch when we're wiping. Like, I'm trying to teach her to have power and autonomy over those areas, and I'm not shaming her for touching it ever. Kids, especially like little kids, they love to touch their body in general, and they love to touch she loves playing with her little labia majora, and she'll be on the couch like butt naked playing with herself. And so now I don't shame her. I am like so big, I'm not gonna be like, don't do that. But what I say is, hey Mayla, while you're on the couch in the living room, it's not appropriate for you to be sitting there playing with your vulva. You can do that in your room, and you can do it when you're wiping to go to the bathroom and when you're cleaning, but not on the couch in the living room. Like, that's just something I don't want to see. So I don't know that there's necessarily a right or a wrong way, but just making sure you're not shaming. You're teaching them it's okay to touch themselves, but giving them boundaries and parameters of when is that appropriate and who is not allowed to be in that area of their body. But if you don't talk about these things with your kids, how are they going to know any of this information? I mean, yeah. What do they understand? So that's my little spin on it. I don't know what your take is, Katie.
I think I should probably just add 2 things as my dogs go insane downstairs.
Oh, I can't hear them.
Oh, good. There's 2 doors separating us and them, so hopefully they'll be quiet. So 2 things I'd add. So I really tried to give my children the responsibility of cleaning themselves in the bath or the shower. And in doing that, I really had to use the correct terminology. In previous episodes, we've talked about uncircumcised sons.
Yes.
It's important for me to be able to tell my daughter, make sure you clean your vulva in the shower and like what that entails. So I'd show her once and then I'd hand it over to her because it's, hers to clean at a certain age. And then my son, I would say, make sure to pull back the foreskin as far as you can and clean underneath your foreskin. So, teaching kids how to properly maintain their genitals is incredibly important.
Yeah.
And they've been doing that for years. So,
when did they start doing that, you think, Katie?
Like 2.5.
Okay.
When they started using soap on their, clean your armpits, clean your vulva, clean your feet, all the important body parts to clean.
Yeah.
And then the other thing, recently, my daughter loves bath bombs. She's obsessed with them.
Mine too.
And she would pick one up at the grocery store every time we would go. So, about, I don't know, 6 months ago or so, her vulva became very agitated, and she was able to tell us. She would say, my vulva is very itchy. And she could explain to us what was going on with her body, and we determined that it was, the bath bombs. But in that whole trial and error, like trying to figure out what was going on with her vulva, because yeast infections aren't super common in children that age, we had to go to the doctor, and the doctor had to look at her vulva. So we had a whole discussion about consents and doctors and, who can touch, as you were mentioning. And I think it was very helpful because we said, doctors can touch your vulva if mommy and daddy are there. And then later on, when you're by yourself. But it was very helpful for her to understand that she had power over her body and telling us what was hurting, and then getting help from doctors when she needed it. It was, I think it was very empowering for her.
Yeah. And gosh, I love all of that. No, you're so on the money. And another, it's just like another thing to really, really understand for you guys listening is when you understand your body, the brain has a better concept of the spatial awareness of everything as well. And so her being able to communicate, this is where I hurt. Do you know how many women I treat in their 20s and 30s who say the whole thing hurts and they don't understand how to tell me, but men can come in and tell me exactly where it hurts because they're taught better, and they have this part of the body is really internalized as part of them. But women don't have that often because they're not taught to really connect with that body part. In fact, they're taught to kind of like dissociate and be shameful and close it off. And we don't touch, we don't talk about, we don't look at. And I can't tell you how much damage you're doing to your child when you do that to that region of the body. Something you were talking about with the cleaning, you're supposed to teach your kids how to take self-accountability for all parts of self-care. And so like, I'm just going to give a couple little examples of how you're already probably doing this as a parent, and you're just going to incorporate it now into cleaning the genital region. My daughter doesn't like to brush her hair. I know a lot of you guys are dealing with that if you have kids. We're past it now because every day I repeated, Mela, part of having long hair is you have to take care of it. Part of self-care for your hair is we have to brush it every day or you're going to have knots, and just kept repeating that over and over. So she didn't like it, but I was like, you have to take care of your hair. Brushing the teeth. They recommend that you really help, I think, brush your kids' teeth up until age 5, I want to say. But you have let them do it, and then you take over and help. And so again, we think about the genital region. You should 100% be teaching them to clean that area. Just like Kitty was saying, the armpits everywhere. Teach them how to do it, but then you still can help them because they might not do a good job. My daughter could care less to wipe after she's gone poo and pee. Like, she just doesn't care. And I'm like, oh my God, Mela. So I'm like, Mela, part of self-care is you have to clean that area. Like, that's dirty to have poop on your butt and then go sit on the couch. That's not acceptable. It's gross. So just wipe it off, and then you can put your cute little butt on the couch. So like, it's just the same thing we do with all other parts of the body. It's no different. It's just applying it to the genital region.
Yeah. And it does give them a sense of power over their own body. And then, that's so important. We're not going to jump into talking about sexuality, but in the next episode that we do talk about sexuality, teaching kids early on about their body and giving them a sense of power over their own body does wonders for discussions of sexuality and consent later on in life.
Yeah. 100%. It'll keep them more protected. They'll be able to tell you what's wrong. They'll be able to tell a person, a boy, a girl, whoever, hey, I don't want you to touch there, because they feel connected and empowered. So nothing more important than that, I would say. So, okay, want to talk about little boys now?
Yeah. Funny enough, I think it was yesterday or 2 days ago, we were riding in the car, and my little boy, who's 6, he just turned 6 a few days ago. He asked me why he had 2 circles in his body down, by his penis. He said, he said, what are these 2 circles next to my penis? And I said, honey, those are your testicles. And he said, why do I have those? And I said, well, later on, they'll help you make babies. Aww. And that's all he wanted to know. He lost interest at that point, but it's a good entryway for discussions that will be coming, in 5-6 years, when he begins to actually wonder about sex and sexuality and what his testicles do and what his penis is for, in terms of sexuality. So, planting the seeds now, when he's 6, or, when your daughter's 3.5, it's really just planting the seeds. It's explaining everything so that later discussions of sexuality will make more sense.
Yeah.
Because if you unload all of that information to them when their bodies are already developing, they're getting breasts, they're getting pubic hair, they're going to be flooded with all of this new information, and they're probably going to be very confused.
Yep.
So, laying the groundwork now is a fabulous idea, I think.
Yeah. And then like something I was just thinking when you were just talking there is when my daughter goes pee and we have like a little pee party celebration, I'm like, good job. I say, good job listening to your bladder. Your bladder told you it had to pee and you listened and you controlled it. And the pee came out of your urethra. Like I'll say things like that. I get kind of more specific because I'm like, it's not the vulva that went pee. It's not the vagina that went pee. The bladder is what communicated, and you listen to that. And then I show her where the bladder is, which is, it's inside, of course, but I show her on that lower belly, like, this is where your bladder is. And when she goes poop, I'm like, oh my gosh, you listened to your rectum. Your rectum told you had to go poop, and you listened to it, and you went to the bathroom and you went poop. Good job. And so like, I'm teaching her these little body parts. I was saying butt for a long time, and I went away from it because I'm like, her butt in her mind is her little cute glutes, her little butt cheeks. And I'm like, I want her to understand the difference between the butt cheeks and the actual sphincter, the rectum. So I could get more specific, but I'm like, I'm not going to do that. Rectum is good enough for her understanding that. But I love that. At least the testicles are for making babies, because that is what their job is in the human body. And
yeah.
If they ever ask, why do my testicles change size? Like, why are they up high or why are they down low? A great response is there's this really, you don't have to get this detailed, I guess. It's really just temperature control. It's your body's way of keeping them safe so they're able to properly make babies in the future. I mean, that's really what it is. It's the cremaster muscle is going up when it needs to be at a certain temperature, and it's coming down when it needs to be at a certain temperature. So cool that the body can do that it can self-regulate how it's storing those awesome little sperm in there. So little simple ways, depending on your child's age, of how much you want to dumb that down or ramp it up. Because if it's a teenager you're talking to, I would be way more specific about it. I would say you've got a cremaster muscle in there, and it can lift them and it can lower it. And it's doing that to temperature regulate to help keep your sperm healthy. So really awesome that your body's doing that.
In terms of like how much information they give, I usually just follow my kids' prompts. So, the discussion that I had with my son in the car, I stopped, he stopped asking questions at a certain point. So the topic naturally changed. But as a parent, I think that I would try to give age appropriate and accurate answers to all of the questions that they have. Because if they continue answering questions and you do something weird, like change the topic or give an answer that doesn't make any sense to them, that's when kids begin to learn, okay, my body is a shameful thing. I can't ask questions about it. I can't openly talk about it. It all needs to be a secret, right? And that's the dysfunction that Molly and I usually see in our office, is when people have learned from a very early age that it's not safe to talk about their bodies. It's not safe to think about their bodies. It's not safe to ask questions or, articulate concerns about their body. That's what we see. That's where the shame comes from. Yeah. So, answering questions as thoroughly as you can as a parent, or saying, "Ooh, I don't know the answer to that. Let me research it and I'll get back to you later." Yeah. That's the appropriate as well.
Yeah. And always remember, because a lot of you might, be a part of this shameful cultural religious mindset that you were raised in. And so when your kids ask you these questions, it's going to maybe make a lot of you feel uncomfortable. And so I would take that and try to be aware of it. And a really good thing for you to do is change it, flip it, say, okay, so if my daughter or my son just asks me, what are these? And they're pointing to their ears, how would I answer that? And you can probably very easily think about how you would answer that. Or like, what are these? And they're pointing to their gums or their tongue. You could easily answer the function of that. And so take that mindset, and that maybe you say, like, let me think about that for a second, and then apply it to the general region and try to have that same mentality. So that way you can hopefully try to get rid of some of your shame and bias that you've internalized, and not give that to your children. I don't know if that would be helpful, but I think it would be.
Yeah, absolutely. Yeah,
Um,
it moves us out of our own way, right?
yeah. Little boys. So we want to talk a little bit more about kind of go in detail about little boys more like we did with the girls.
Yeah. Well, I mean, I think maybe it's a little bit easier because everything's on the everything that little boys see and care about are it's on the outside. Their
Yep.
penis, their foreskin, if they still have it, their testicles.
Yeah, it's pretty simple.
Yeah, it really is. And I think the biggest thing with little boys is if what whether or not they have their foreskin there, because that includes a discussion about how to clean the penis appropriately, and what to do if it starts hurting. Like if because sometimes the foreskin can hurt if it's not cleaned appropriately underneath, and it's important for little boys to be able to express that if that's occurring.
Yeah, 100%. So, I mean, my son is so little and it is all on the outside. So it's, to me, it's so simple. Like, this is your penis, these are your testicles, this is your rectum, this is your butt. I mean, it's so much easier with boys because of that. And a lot of us don't also have like the shame and weirdness around male genitalia for little boys. Little boys love to play with their penis. They love to pull on it. And it's totally fine. I would say please don't shame them for that. It is very okay unless they're hurting themselves. I remember I used to nanny a little boy. He was a little aggressive and he was hurting himself. So just teaching them to be gentle. Hey, be gentle with that area. So you're not saying don't touch. You're just saying you're teaching them how to properly touch their body parts. I think it's very important because, this is something I never knew until I started nannying. I never knew that little babies got erections. I don't know why. I was like, what? Like they get erections this young? And so once my son's old enough, I am going to make sure he understands like this is an erection and using the proper terms and telling him like blood is going into your penis. And that's why, and it's super cool. Your penis can be small and it can grow bigger. And this is very normal. And when he's age appropriate and ask questions as to why it does that, I will tell him it's in order to make babies. That's why the man has an erection. So, just my last little tidbits, I guess, on that. Any other things you want to cover with boys?
No, just probably the erection talk, right? So my son hasn't asked any questions about why his penis does that. He just announces it. My penis is hard.
Oh my God, I love that. That's amazing. Boys are so funny. Oh my gosh. Okay.
Yeah, he thinks it's hilarious. And we don't, say anything that would give him any shame about it. We just acknowledge that it is indeed hard. Congratulations.
So it's so funny you bring that up. So I grew up with 3 brothers. And so my brothers, God, this was like torture for me. I would be out eating breakfast and my brother, Michael, he would always come out in his boxers and he'd be like, good morning. And he'd always have a morning wood and he would do it just to mess with me. And he'd be like, so my family was very sex positive. I didn't know that growing up. It's just my family. And I would be like, gross, get away. And it was just like a funny thing that they would always mess with me clothed with their freaking boners. And I was like, get away from me. So I am going to make sure though. And then my brothers would always have their hands in their pants. Men are always readjusting themselves. So one thing that is important for me to teach my kids is, hey, my son, hey, totally cool that you have an erection, but please don't come out and just show it to the whole family. That's something that you can do in private in your own room. There's nothing to be ashamed about it, but it's not something that your sister and me want to see. I wish my mom kind of would have done that because it was just annoying. They just did it to screw with me. There was one other little thing I wanted to add with that.
I think privacy and consent are the 2 main things that we're highlighting here, right?
Yeah.
Important to teach children what's okay to do, out in public with the family and then by themselves.
Yeah.
So those things are really important. And then also consent, little kids have no boundaries, no physical boundaries at all. So it's our job as parents to be like, it's not okay to touch other people's bodies without their consent anywhere on their body.
Yeah.
So, that's one thing that we're teaching our children is, even mom and dad, if my little boy sees my husband slap my ass all the time. And so he goes and does it. And I'm like, that's not that's not okay, right? Daddy can slap mommy's ass. But you
So
can not.
funny. Yeah, no, I love that you said that because I always like give May like a little pat on her butt, and so she'll come up to me and start doing that, and I think it's the cutest thing. But I'm like, at some point, I'm gonna have to tell her like, hey, you can't just like come up and just give me a little pat on my butt anywhere in the house. You can do it because I think it's so cute. But I do ask my kids for consent. I say, Mayla, can I have a hug? Can I have a kiss? I'll tell you, a lot of times she tells me no, and I say okay.
Yep.
This morning she told me no when she woke up, but she was demanding milk and all this other stuff. And so I'm not saying this is a good parent move, but I was like, hey, if you want me to go get you all those things and be your servant this morning, then my currency is hugs and kisses, and I need a hug and a kiss. And she said, okay, and ran over, gave me a hug and a kiss. And she goes, can you get my milk now? I was like, yes, I'm gonna get your milk. Not saying you guys should do that, but I thought it was really adorable. It was just consent. She was like, okay, like I want this, mom wants that. Sure, I'll make this decision to meet mom's needs right now. Not that she needs to meet mine, but I'm happy she did because I love kissing and hugging her. Okay, I want to move on to periods and menstrual cycle. Yeah. So my daughter, again, like I said, is 3. Kitty, how old's your daughter?
I should be 5 in a few months.
Okay, 5. And then you got your baby.
And baby. Yeah, another penis.
Baby. So right now, I know you who are listening who are parents, you know, your kids are always in the bathroom with you. Here and there, there's no boundaries, right? Nor do I want there to be. Okay, a little side note that just popped in my head. I walk around naked all the time in my house. I just love being naked. And so my daughter is so cute. She'll be like, Mommy, you naked? She'll be too. And sometimes she is, and sometimes she has underwear on. I'm like, no, you're not naked. You have underwear on. But yes, mommy's naked. And she gets so excited when I'm naked. I don't know why, but she knows how to differentiate whether we're naked, again, because that goes into the proper boundaries and privacy. Because I always tell her, because for a long time, she kept wanting to go outside naked in our front yard. And for a while, I allowed it because she's so little. But now we have so many neighbors. And I just am like, for me, I was like, I don't really want my male neighbors seeing my very developed 3.5-year-old naked. It's just weird for me. So we had a big power struggle with that because she always wanted to be naked outside. And I said, listen, if we're going outside in the front yard, you do have to have clothes on because we have to cover up your private parts. It's not appropriate. So anyways, understanding naked was a big thing for her to help understand when we need clothes on and when we don't need clothes on. And she knows in our household, for us personally, like it is free range to be naked, spread your legs, do whatever you want, dance party. We are nudists. But outside of the walls, no. Anyways, with the period, she's in the room with me all the time when I'm changing my pads or changing a tampon. And her and Clark are so interested. They're like all up in my business. Like, what's that? I, again, do not shame them. I don't tell them to look away. I'm like, I want them to see me doing this. And so me, age appropriate right now, I say, yes, this is a tampon. It's got blood on it. Mommy has blood coming out of her vagina. I'll say that. You don't have that yet, but you will eventually. This is part of the female body. And like, I just try to keep it very simple. But as she gets older, I'm going to teach her about the uterus. I'm going to teach her, and for me personally, I'm going to show her pictures of a uterus on anatomical pictures so she can see the inside of her body. How else are we going to do that? I'm going to teach her that every month it builds up this beautiful thick tissue to help support an egg that gets fertilized. But because that's not happening, it sheds it. And that's our body's way of being really efficient. And that's why it sheds it every month. And it's a totally good, beautiful, healthy process. It's our body being super energy conserving. And so this is it flushing it out. You see the blood, and now it's going to start to rebuild back up again. And so again, using age appropriate understanding of why do we have a period as women or menstrual cycle, and then how to properly take care of it. So yes, mommy has a pad on her underwear. Yes, mommy personally uses tampons. Some women might only use pads. Some women might use the cup. I think if you have a daughter or a son, actually, you should be teaching them this. I don't think boys should be oblivious to this, because one day they're likely going to be talking to women, maybe married to a woman. Like, they need to understand this and not be a clueless dummy, so they can actually help. I'm going to teach my daughter, me personally, why she gets so sad around her period, why she might have the symptoms she has. There's such a huge correlation with our estrogen and our serotonin levels. And serotonin is one of our really feel-good hormones. And so that's why we get so tired and moody as women. And I want my daughter to understand her human body. I want her to understand the cycle, the monthly cycle that we go through as women, and how it's going to affect her very differently than her brother and men. And as she goes through life, I'm going to continue to help her understand the changes that are going to occur during perimenopause and menopause. And I know that's way later down the road, but I'm going to make sure she understands that at a young enough age where she cognitively can, so she can appreciate and love her female body and understand that it is completely different than a male body.
Yeah. Yeah. That's all. Yeah. I do the same thing with my periods. My kids are fascinated.
Yeah.
And they'll say, why are you bleeding? And I say, well, it means mommy's not pregnant. And they get sad, but I'm like, yes, not pregnant.
Oh my God.
That's what they know about periods right now. It means that mommy's not pregnant.
I mean, it's true. That means you're not pregnant. There's no fertilized embryo in there. So the body doesn't need this tissue to help the baby grow. So it's getting rid of it. And yeah. I always like to tell people, tell my kids, why the body's so cool for doing that. And the reason why is it's being very energy efficient. That's why it's getting rid of it.
Yeah. They used to be very scared of it. Like, why are you bleeding so much? Like, are you hurt? Can I help you? And so I spun it into something positive, right? Like, this is natural. This is normal. This happens to mommy every single month. And it means a good thing. It means I'm not pregnant.
Yeah.
Because we can our babies in this house.
That's good. When were they afraid of it? What age did they start to become afraid of it?
When they became afraid of their own blood, like if they got scratched and they saw their own blood and then they started, panicking because of their own blood, they assumed the same thing for me, right? They saw all the blood and they thought that I was hurt or that I needed a Band-Aid.
Yeah, no, that's good to know, because I'm like, my kid's not afraid of it yet, but she's also not afraid of blood. I did a little too much, I think, pain neuroscience with her. She's like so little too nonchalant and calm with her body. Sometimes when she needs to maybe be like a little bit more concerned about things. I'm like, Mayla, like, you're bleeding right now. Does that hurt? She's like, no, I'm fine. I'm like, okay.
Oh, good for her.
Yeah. So I will say, getting into slight pain neuroscience, like piggyback off of what you just said, it's so important with kids to teach them about the body, like we're talking about, but that does come down to it being hurt and irritated. So like with your daughter, we know that with little girls, we have to be careful with anything in the bathtub, because it can really irritate the vulva. And so when that happened with my daughter, I'm really selective of how often we do bubbles in the bath. And I actually do tell her, I say, we can only do it every once in a while, because it can irritate your vulva. I'll tell her that. So she understands kind of what's going on and how to take care of it. But when she gets hurt, it's so important when your kids get hurt to not react. This is so hard for people to do. Do not react, and ask them, how do you feel? Are you okay? Don't tell them they're okay. That's something that parents do all the time. You're okay. You're okay. No, because now you're teaching them, don't listen to my own body. I'm going to listen to mom for how I'm supposed to react right now. And that's awful. So you want to teach them to be intuitive with their own body. So when they fall and get hurt, are you okay? And then my daughter will get up and she'll say, yeah, I'm okay. Or sometimes she's not. She's like, no, my foot hurts. And she'll tell me. So that's you teaching them how to really listen to their own nervous system. When they bleed, like from shots, I remember just recently I took her for shots and she screamed for a second and she was bleeding. And she said, that hurt me. And I told her, I said, that did hurt. But it's over now, and it was safe for the body. That was you getting a vaccine for your body. It's perfectly safe now, but your body told you something poked you, which was really good information. But there's no need to worry about that anymore, because you're perfectly safe. And we have a Band-Aid over there. It's no longer bleeding. And she calms down right away. So like, I'm really trying to constantly teach them how to understand the messages their body's giving and not putting my own perception of what their body is experiencing, but teaching them to explain that better to me.
Yeah, that's a great point.
Yeah. So like the period though, that's a good point. It's like now they see blood and they're like, oh my God, what does that mean? But just because we're bleeding doesn't mean that indicates pain.
Yeah. Yeah. They used to say, does it hurt? I'm like, no, it doesn't hurt at all.
Some people it might hurt. Some people, if you got like endometriosis or PCOS, which I would explain that. I would explain that when you feel ready, because chances are they're going to encounter friends or girlfriends or other people in their life that are going to deal with painful periods. Not that that is normal, but it's very common.
Yeah.
Any other things that we should talk about?
I don't think so. I think we're tiptoeing now into a discussion of sexuality, right? Like what comes after periods.
Yeah.
And need to start thinking about, the possibility of pregnancy. But we will talk about that in the next
episode. Yeah. I guess last thing is we didn't cover his boobs, and I'll just
sure.
quickly talk about that. Is I do differentiate with my daughter the difference between nipples and breasts. And because I breastfed both of my babies and she saw me breastfeed, she always would say, Clarky's boobies. She'd point to my boobs, Clarky's boobies. I'm like, no, these are mommy's boobies, but they do feed Clarky. And so my kids do understand that the purpose of the breast for women is to feed a baby. Of course, we've sexualized the breast, but that's not the reason why we have breasts. We have breasts in order to feed a baby. And how incredible and cool is that? So, and she knows, she loves to point to her boobs. These are my boobs. This is my nipple. Clarky's nipple, Mayla's nipple. And I'm like, yep, those are your nipples. She loves to point to my nipples too. And I'm like, okay, you can point, but don't touch. Because she, for a long time, was wanting to just grab them all like they were hers. And I was like, no, these are mommy's body parts. These are mommy's boobs and mommy's nipples. Because now they're not breastfeeding anymore. So I'm like, back off.
Yeah.
I'm like, mine, get your hands out of my shirt. All right, but that's it. I hope that this was helpful. And if you guys have any questions that may have come up while you were listening to this episode, remember you can always email Dr. Katie and myself. I think we have all of our information listed. We love questions and would be happy to discuss it further with you.
Yes.
Bye, all. We'll see you at the next episode.
We are Dr. Molly Hart and Dr. Katie Schubert, and you've been listening to Sex on the Floor podcast. We really hope that you enjoyed this episode. If you have any questions and want to get in contact with us, you can follow us on Instagram at Dr. Molly Hart and at Dr. Katie Schubert. On Facebook at Pelvic Balance PT and at Dr. Katie Schubert. And for more information about us on our websites, you can find us at pelvicbalancept.com and at drkatieschubert.com.